Hi everyone, Dr. Leah McNeil again, and I have some tips about helping with your heart disease risk, especially for women, but also for men. Check your blood pressure. This has been something I'm sure you've heard a lot, and the typical levels of blood pressure that we've always heard are too high is 140 over 90 and above. Nowadays we treat blood pressure a lot sooner. 130 over 80 and above could be an issue for some people depending on what's going on. Do they have obesity? Is there diabetes? Is there other risk factors? And in those cases, I treat a lot sooner. So always know and check your blood pressure. You can get a blood pressure cuff at your local pharmacy, and the pharmacist can actually recommend a good one to get. Some other things that are important to check, which are done via blood, are C-reactive protein and homocysteine. These two markers, especially C-reactive protein, is an inflammatory marker. Some doctors believe that your C-reactive protein being high can be a major contributor to hypertension or high blood pressure. So C-reactive protein should be less than 3 on your blood work. It can be brought down with anti-inflammatories like boswellia or ginger or vitamin D, curcumin, but it can be a little more complicated than that because some people just make a lot more, but it is a good number to know because it definitely is a factor in hypertension. Another marker is called homocysteine. Homocysteine is from the protein we eat, and we break it down and we get rid of it for the most part. If it's elevated, it can be a factor in possibly hardening our arteries or increasing our risk for blood clots, but it's usually easily brought down by taking B vitamins. That one's a lot easier to control for the most part than C-reactive protein. Homocysteine should ideally be less than 10 in your blood work. So get those checked. Another important one that's not checked very often, especially in men, is ferritin. Ferritin is our stored iron, and it should never be ideally over 200. I know in blood work sometimes it goes up to 400 for the reference range, but that's just too high. Ferritin is a major inflammatory marker when it's too high. It's iron, we need it, but we don't need too much. So if it's elevated, if it's over 200 or 300 or 400, you need to donate blood to get it lower. Iron can store in your heart tissue and increase the inflammation in your heart and probably increase your risk for heart disease. It can also deposit other areas of your body. So get your C-reactive protein, homocysteine, and ferritin checked. Hope that helps. Have a good day.